Hey everyone, my name is Nyash Malika and I am your pre-physical therapy guide. Today in this video, I wanted to come on here and talk about how this coronavirus situation can impact our future interactions with our patients. So in accordance with social distancing, a lot of schools, a lot of facilities have shut down in efforts to combat the virus spreading so quickly. And with that being in mind, a lot of us are at home, in the confines of our home, and we're not able to do our quote-unquote daily normal activities. And with this in mind, I want all pre-PTs to have a better understanding and empathy regarding patient care. And what I mean by that is having a better understanding and empathy for what some of our patients are going through and the importance of physical therapy. Physical therapy is basically the field of improving one's quality of life. If you haven't started PT school, or if you're in a kinesiology or exercise science major, you probably have heard this term a lot. And basically the quality of life is making sure that to help facilitate individuals having a quote-unquote normal life. So things like walking, things like bathing, things like picking up their grandkids, things of that nature, that an individual can do within normal function of their own bodies. And in accordance with social distancing, and keeping in mind that we are restrained to our homes now, that I hope that pre-PTs take a minute and reflect on this time and hopefully empathize with their patients or their future patients moving forward. So in accordance with social distancing, we are pretty much confined to our homes, and it is discouraged to go outside for large social gatherings, things like parties, game night, whatever your movie theater night, whatever that means to you in your normal socialization, has been limited. And one thing I wanted to use this platform for was to bring awareness to individuals with disabilities, because that is something that is a reality for them in their everyday lives. So because of social distancing, you might feel a bit antsy about just staying at home. You might have had a trip planned, you might have had a party planned, some type of event that you were going to go to. Those events are probably canceled, and you're no longer able to go and you're staying at home. And so one thing I wanted to acknowledge, and hopefully you guys can empathize with, is what people with disabilities, geriatric people in skilled nursing facilities, our future demographic, our future patients, individuals with like back issues, anything restricting mobilization. And the importance for pre-PTs to realize that when you restrict one's mobilization, you decrease their quality of life. And this is kind of a hopefully eye-opening experience for you as to what other people are dealing with and what your future patients are dealing with. So individuals with disabilities, they might have had this idea of going to school, right? The socialization of going to school, that wanting and longing to go to school, and that reality has changed for them, whether that be after a spinal cord injury, after a traumatic brain injury, whatever have you, whatever neurological condition has changed that reality for them. And the same goes for geriatric, depending on their current status, their level of mobility and abilities have decreased. And, some of them wind up in skilled nursing facilities or other facilities that help them prolong life. But we as pre-PT students and we as future physical therapists need to look at the quality in which that life is being lived. And so dealing with this coronavirus and we ourselves now having to change that life that we had for ourselves, I'm hoping that all of you all take this moment and reflect and really get a better understanding, hopefully, of what those other demographics are usually dealing with on a regular basis. So you and I are fully able to get up and walk to the grocery store if we wanted to. We can hop in a car and go visit our friends if we wanted to. And the demographics that I spoke about prior, they might not always have that option. They don't have that level of freedom that we honestly take for granted every day. So moving forward, hopefully all pre-PTs have this level of understanding, a different level of empathy, a different level of how they're going to approach the mentality in which they treat their patients in the future. I personally have been an advocate of people with disabilities for many years, and I do think it's important for us as healthcare providers to be an advocate for them, to speak up for them, to make sure that they have just as many rights and access to healthcare as everybody else. And I just really hope that through this video, pre-physical therapy students can have a better understanding and a better mindful reflection of what their future patients might be dealing with or how they might be feeling. Take in how you're feeling that those plans are canceled, that you can't go to those locations, and have a minute of reflection as to how those patients that you interact with in the future might be feeling as well. And hopefully, we can increase the level of care, the quality of care, the quality of life that we're hoping to help facilitate in the future. So go ahead and leave a comment below about how you've worked with these populations, what has been your understanding of their realities, and leave a comment below. I would love to hear from you guys so we can have a discussion. And thanks for watching.